Hey everyone, let's talk about hypertension and vagus nerve stimulation. Patrick Wong Pao, FA 5270, asked if I could take a look at what vagus nerve stimulation does when you have high blood pressure. So I found one study where they were looking at early intervention. So they wanted to see if they could slow the progression and improve hypertension in a group of younger people, young adults. So this study looked at individuals between the ages of 18 and 39 years who had idiopathic hypertension, so no known cause for their high blood pressure. The blood pressures at the beginning of the study were between 140 and 159 over 90 to 99. And they divided these individuals into two groups. One group was the experimental group that got true vagus nerve stimulation. The other group was the control group that got sham vagus nerve stimulation and education on lifestyle modifications that typically improve blood pressure. So they were kind of comparing what happens if we just teach people how to modify their lives by changes in diet, exercise, and stress management, and what happens if we just do vagus nerve stimulation. And so there were 23 people in each group, and what they found was that at each of the follow-ups, 1 month, 2 months, and 3 months, each group had improvements in their blood pressure. The group that got the true vagus nerve stimulation, however, had statistically significant improvements above and beyond what the control group had. So the groups at the end of the 3 months, the control group, so the group that did not receive the true vagus nerve stimulation, but the sham stimulation, their average blood pressure was 136 over 87. And the experimental group, their average blood pressure was 128 over 80. So much closer to the normal of 120 over 80. I also saw some studies on rat models, which is really common in scientific research. So this study that I looked at was looking at vagus nerve stimulation on severe hypertension in rat models. And what they found was that the vagus nerve stimulation slowed the progression of endothelial dysfunction and aortic stiffening. This is really important because typically when you have hypertension, over time, the hypertension makes these things worse. So what happens is it becomes kind of this cyclical issue where the hypertension makes your blood vessels more stiff, and then that in turn makes your hypertension worse, which then makes the blood vessels more stiff, which makes your hypertension worse. And so when the hypertension is uncontrolled, this becomes a big problem, and hypertension is a major leading risk factor for heart attack. So very important to slow that progression of the hypertension. So the suggestion was that vagus nerve stimulation is an excellent adjunct therapy among other therapies like medication for slowing the progression of high blood pressure. Thank you so much for being here. My name is Carissa Conrad, Doctor of Physical Therapy and Therapeutic Pain Specialist, and I am the Vagus Nerve PT. We'll see you on the next one.